Well, I am not good in English, so I would like to speak in Japanese. Well, thank you very much for giving me a very good opportunity. I would like to thank the organizing committee. So I don't have any disclosure. Well, until March of this year, I was working at the National Cancer Center Hospital in Japan, specifically as a nurse in the respiratory and the clinical research ward. And I would like to talk about the nursing to the patients who are going to receive the immunocheckpoint inhibitors. Well, in order to have a very safe immunocheck inhibitor treatment, I would like to talk about what we have to be especially careful of as nurse in, and I'd like to talk about 3 points. First is about the AE management from the inhibitors, and also the second is to consider about the support patients and families with financial concerns, and also the third point is we have to manage the over expectations among patients and families. And as you know very well, the immunocheckpoint inhibitors is targeting the substances which is going to inhibit the immune system, and by doing so, it is going to indirectly attack the cancer cell by activating the immune system. So this is very different in terms of the mechanisms, and it's a totally new treatment. In Japan, we have 2 types of immunocheckpoint inhibitors. One is from December 2015, the nivolumab is available, and also in December of 2016, pembrolizumab is available. And this is indicated for the NSCLC, which is unresectable and advanced and recurrent. And pembrolizumab is limited to the PD-L1 positive subjects, and pembrolizumab is possible to be utilized from the first line. Now, I like to talk about the management of adverse events from the immunocheckpoint inhibitor. But since this treatment is still new, so we do not know clearly what kind of adverse events is going to emerge from this treatment. This table shows the adverse event incidence of the nivolumab and pembrolizumab to the melanoma patient, and about 70 to 80% of the patients are actually experiencing the adverse event, and the highest incident is the fatigue, followed by diarrhea, rash, and pruritus. And the fatigue and diarrhea, which is of grade 3 or 4, is about 1 to 2%. The immunocheckpoint inhibitor is adverse event is occurring because it goes through the mechanism. So it's an immune-related adverse event. And the highest such adverse event is the hypothyroidism, and also the hypophysitis, and also colitis, and hepatitis, pneumonitis, and type 1 diabetes. Even though the incident is limited, still there are some concerns because these adverse events might become very severe. So it is very important to detect early. Since the approval until the March of 2017 in Japan, the reported incident rate of type 1 diabetes due to the anti-PD-1 antibody is 0.32%, which is 54 cases amongst 16,743 patients who received this treatment. And also 3 cases are reported who experienced fulminant type of the type 1 diabetes, and they were the NSCLC patients. And this shows the research that we made at the NCC between 2015 to 2016. The NSCLC patients who had immunocheckpoint inhibitor, in total of 102 cases were included in this research to see what is the incidence of the adverse event is at the NCC, National Cancer Center. And it is very close, similar to the table that I showed you before. However, specifically in terms of the respiratory adverse event, we do not know whether this is due to the immunocheckpoint inhibitor or whether at the baseline there was already the respiratory related symptoms. So it is very important to have the symptomatic assessment pre-treatment at the pre-treatment level. And also in the NSCLC patients, the immuno-related adverse event were observed in 5 cases out of 102 cases, and the breakdown is the hypothyroidism and diarrhea. And if we include the progression of disease, 4 out of these cases had to discontinue the treatment. Now, next, I'd like to talk about the patient flow that is being adopted at the National Cancer Center until that patients are receiving the immunocheckpoint inhibitor. But first, the patient is going to have the common blood test, BG, CPK, TSH, FT3, FT4, as well as the chest X-ray. And then afterwards, the outpatient nurses are going to take the assessment and also to check the adverse event and then put it into the patient chart before the consultations by the physicians. And if there's any adverse event due to the immunocheckpoint inhibitor, sometimes the nurses are going to direct the patients to the consultations to the respiratory doctors or the endocrinologist, ophthalmologist, and GI specialist. And after the consultations by the physicians, and if the patients are going to receive the immunocheckpoint inhibitor, then the patients are going to receive that in the outpatient's chemo unit, and also being checked with regard to the adverse event by the nurses and pharmacists. And this shows the checklist for the adverse event due to the immunocheckpoint inhibitor, and this is going to being utilized at this NCC. And this looks at the respiratory symptoms and the skin symptom, GI, as well as the myalgia and arthralgia, as well as the thyroidism dysfunctions and the hepatic function is being checked. And before the doctor's consultation, the nurses are going to do the hearing from the patients so that the nurses will be able to share the information with the doctors. And as for the management of the adverse event at home, patients are instructed to notify physicians immediately in case of hypertension, nausea, headache, chest or lung, region pain, breathing difficulty, fever of more than 38 degrees, severe shortness of breath and persistent cough, severe diarrhea and decreased oral fluid intake, persistent abdominal pain, bloody stool, visual field defect. If these symptoms are experienced by the patients are guided and instructed to contact the hospital. Also, the patients will be given the alert cards so that the patients, when they are going to the other doctors, then the doctors will know that the patient is receiving immunocheckpoint inhibitor. And also, the other primary doctors would know who to contact. But since it is only a short period of time since the approval of the immunocheckpoint inhibitor in Japan, so we do not know what kind of adverse event will appear. So at the Kyushu University, they have the Committee of Immune Checkpoint Inhibitor, where they are having the multidisciplinary team to counteract to the various adverse event that is likely to become apparent from this immunocheckpoint inhibitor. And the important points in the management of the AE is that the nurses, there are some challenges on the part of the nurses. That is because they don't know what kind of unexpected adverse events will come out because there's no sufficient evidence. And also early detections of the immune-related adverse events is crucial due to the possible deteriorations. And management of the adverse event has to be done by the multiple specialist department and multidisciplinary team. It is very important that the nurses are aware of that. Now, next I'd like to talk about how we will be able to counteract to the financial anxiety that is held by patients and family members. Well, the immunocheckpoint inhibitor is sometimes, often taken up by the mass media, but it is a very expensive compound. If the 60 kilograms body weight patient is going to continue on this nivolumab for 1 year, then it costs 17 million yen, and pembrolizumab 14 million yen. And the indication is there's an added indication. Therefore, the cost is slightly decreased. However, still it's very expensive. In Japan, there's a high-cost medical expense reimbursement system. So the individual patients has to bear the cost of 80 to 100,000 yen, but the other cost will be borne and subsidized by the nation, by Japan. However, the patients or the family members says, well, I cannot afford such an expensive drug, or they say, how long do I have to continue the treatment, or even though that they can get this reimbursement, still they will not be able to continue on paying for a long time. Or they say, like, should an elderly person such as myself continue to rely on the government to prolong my lifetime? So to those patients and family members, the nurses have to really listen carefully of what the patients and the family members are thinking, and also have to explain about the systems of subsidies by the government, and also has to give a full detailed explanation so that the patients and the family members will be able to utilize the social resources smoothly. And they have to link and cooperate with the medical social workers. Now, next, I'd like to talk about how to manage the excess expectations on the part of the patients and families. This slide shows the title of the homepage at the internet. That it says that because the immunocheckpoint inhibitor is taken up in the mass media in Japan, that it is a kind of a revolutionary medicine and a medicine of the dream that is addressing to the the progressive disease or cancer. So there's an excess expectation. And some patients ask, if I have this checkpoint inhibitor, then I will be cured totally by the cancer. However, it is important to talk about the adverse event to the patient, because if the patient considers that there's not going to be any adverse event, then they will be late in reporting the adverse event, or sometimes that they are disappointed because of the adverse event. And so through this type of patients, it is very important for the nurses to listen to the expectations and then provide the accurate information. And if necessary, then it will be important for the nurses to contact the physicians so that the physicians also can explain to the patients about the expectations that they can have. Also, that sometimes the patients who are not indicated for the immune check inhibitors want to have the immune checkpoint inhibitor treatment. Then the nurses have to really accept and accommodate the wishes of the patients as well as families, and then also give a very detailed explanations that the immune checkpoint inhibitor is not indicated for all cancer patients, but there's another type of standard of care which will benefit the patients. Also, that because there are some patients saying that I heard immunotherapy is a dream treatment. However, it costs so much. That is because this is one of the cases that the patients went to the clinics in order to get the immunocheckpoint inhibitor. And but the clinic is providing not the immunocheckpoint inhibitor but the immunotherapy, because it's very difficult for the patients and family members to distinguish between the immunocheckpoint inhibitor and other type of the immunotherapy. So I think it will be very important to confirm whether the expectations on the part of the patients and family members is actually the immunocheckpoint inhibitors or immunotherapy. So from this, the take-home messages is to provide a treatment with the immunocheckpoint inhibitors with the utmost safety and comfort. It is necessary to assess the patient closely for the early detections of the adverse events to avoid deterioration. Also, a good use of the multidisciplinary team and each specialty department is a key to success. Also, the offer support and available resources to the patients and families with regard to their financial concerns, and in combinations or in coordinations with the social workers, and also to provide the accurate information to avoid the excess expectations on the part of the patients and families, so that the patients and family members will have a very good understanding about the treatment that they're going to receive. That is about all. Thank you very much.